All right, well, good morning, everybody. I think we're going to go ahead and get started. Welcome. Today, we're going to be going over equity impacts of COVID-19 in the North Sound. Quick bit of housekeeping, and then I'm going to throw it over to Nicole to get us going here. So my name is Mike Reich. I'll do a little bit of an introduction here with Gwen in a minute, but quick housekeeping on the webinar. The audio is one way, so you guys can hear us. Best way to provide feedback or ask questions is using the questions tab or the chat. So as we're going through, if you have any questions about what we're talking about, feel free to just go ahead and put it in there. And then after each section, we're gonna pause and take a minute to answer those questions. Works pretty well. Also, would love feedback if there's other ideas or sort of bigger topics that we could tackle here in the future. Would love to know and get any other feedback on the content. So we will be sending, as this always comes up, we will be sending both a recording of this webinar as well as the slides out afterwards. So if you registered, you'll get a link and then you'll also get an email from us later today with the actual slides and a recording link that you can share with other folks. So that will be coming for sure. All right, Nicole, you want to kick us off with an introduction?
Yeah, you bet. And I'm seeing a list of familiar faces and then a couple new folks. So if you haven't joined a North Sound ACH webinar or meeting, we always start with a land acknowledgement. So I'm going to do that, and then I'm going to go into detail kind of about how this webinar aligns with some of our future work. So with the land acknowledgement, we begin by acknowledging with humility that the land where we are today is the territory of the people of the Salish Sea. Their presence is imbued in the waterways, shorelines, valleys, and mountains of the traditional homelands of the Coast Salish people since time immemorial. And I will go ahead and put this link in the chat. If anybody is interested, we have been helping our partners working towards their own land acknowledgement statements. So we found this website to be really helpful. So I'm just going to go ahead and put it in there as I test my own technology abilities. Okay. And we could go to the next slide. Thanks, Mike. So most of you, I think, are pretty familiar with the North Sound Accountable Community of Health, but I thought I would just level set on why we're hosting this call with Mike and Gwen, and kind of where we think we're going with this. Many of you know that we've been, as our CEO refers to it, as our equity and tribal learning journey. We're about 3 years into that, and over the last, I would say, last year, we have been looking for ways that data can inform decision-making, especially around some of the inequity and disparity work that many of us are kind of touch upon. Recent response to George Floyd's murder, Liz had posted a blog post and it was called Calling Us to Action. And she, since that post, she has been encouraging our organization to really lean into racial and social justice in action and look for ways, ideas, collaborate with, kind of kindred organizations who are also taking this leap immediately. Some of this work we had been planning to do in 2021, and we are just fast tracking that. This seems like the right moment to do that. So much of what we're kind of thinking for this data community for good initiative really is framed around let's get going and let's figure out how we can do data analytics in a way that informs decision making and then also brings awareness to some of these racial and social injustices that we're seeing. And I will go into, towards the end, a bit more of like what we're thinking about that, and then how Mike and Gwen have been just awesome in shaping this webinar to kind of help both inform us, inspire us, and then they've got some recommendations for our group moving forward. And then also just wanting to mention that there is maybe parallel efforts going on around braiding kind of COVID recovery efforts and community planning efforts that I believe this data work will overlap with. So I just want to mention that because there'll be more to come, and we'll do the best we can to kind of keep everybody up to date on how that's going. And I think that's it, Mike.
All right, great. Well, thanks, Nicole. Yeah, so for those of you that I've met, it's great to see you again. A lot of new faces. So quick introductions. My name is Mike Reich with DataContours. We've been working with the North Sound for about 3 months on specifically some COVID impact work, but our long-term sort of history and expertise on population and community health. So it's been interesting, and we're excited about continuing to work over the summer here to help the North Sound think about what these broader community impacts are likely to be, and then tie some of the work specifically back to healthcare and social determinants. Right, Gwen, you want to give a quick introduction?
Yeah, hi everyone. I'm Young. So I have spent my career overseas mainly doing exactly this sort of recovery, economic development, public health, and gender equity. So you can see I have a 501c3 called Balanced Up Leadership, which focuses on women leadership in government. At this point, I'm doing some geopolitical consulting, but in this vein, Mike and I have worked together a long time to tie sort of the use of data to make it accessible, but to tie it to policy processes and systems with a good sort of social equity outcome. So good policies, good processes, and very much kind of what everyone on this call is committed to is making sure that we are inclusive of what the community looks like and what the needs of the community are, and how do we drive a process that that has good outcomes that serve all members of the community. So I will stop there.
Great, thanks, Gwen. And that was a good segue into what we're hoping to cover today. So we've split this into 3 chunks. We're going to talk about first kind of what the impacts have been, and we'll think about COVID very broadly, and talk about some different things that we're seeing, some data that I think is particularly relevant, both as we think about sort of what immediate needs are, as well as thinking about what, as Nicole mentioned, the longer road to recovery looks like in communities. And then we've got some sort of broad learnings, as Gwen mentioned. She and I have worked for a long time together around data, and specifically this connection between data and policy change. And so we've got some thoughts just about sort of what works really well and how to think about it. And then the last part will be some specific kind of a roadmap to think about how to do this type of work, and then some specific recommendations for the work that you all are embarking on in the North Sound. Okay, so as we think, we're going to start around impacts, looking at the near term, and we'll kind of broaden out. So we start with the kind of the big number. So far in the last 90 days, there have been 231 deaths in the North Sound from COVID. And this obviously is creating a ripple effect. A number of sort of challenges and crises are happening in real time. And as we sort of, one of the challenges and themes that we'll be coming back to from a data perspective is this is very fast moving and largely unprecedented in a lot of ways. So understanding, not just getting the data, but understanding what the data means can be really, really challenging right now. As we think about from an equity perspective in particular, one of the themes that keeps cropping up and good data research continues to come out almost every day is that the impacts of COVID have been unequally distributed. And in fact, the populations that started off already facing challenges around equality and disparities have felt most of the impacts of COVID, both the disease as well as the social and economic impacts. And so kind of the key takeaway from this is it's made what was an already challenging situation even worse. And as we look forward, the people who would have been struggling are going to be struggling even more. And so there's this underlying sense of urgency, both in needing to address and alleviate some of the impacts, but increasingly recognizing that just sort of putting a Band-Aid on the impacts in the short term is insufficient. We need to think about addressing these long-term barriers to equality as well. And that's going to be an overriding theme of that we come back to. So as we think about the health impacts immediately through the equity lens, nationally, folks with comorbidities are about three times more likely to die of COVID. In some places, this is as high as 12 or 15 times. So there's a real challenge here in that those folks who are more susceptible, generally are in poorer health, are more susceptible to infections and negative health outcomes. And from a equity perspective, it tends to be there tends to be alignment between minority populations, underserved populations, folks that are already dealing with inequalities, both economically and in the healthcare system, who end up having poorer health, who then end up feeling more significant impacts from COVID. So that story, especially around race and ethnicity, the nuance to add there is it is a very solvable problem in the conversations that have been happening around social determinants of health for a long time. If we can solve some of those challenges that these communities face, then the disparity in impacts from COVID can go away, because there's nothing in particular about your race and ethnicity that makes you more susceptible. Rather, it's the combination of factors around economy and healthcare and poverty, which make you more susceptible. So we see that as a pretty consistent theme, and it is a really complex combined story between this idea of economy and poverty and health outcomes, of which COVID has sort of exposed this in some pretty dramatic ways. Thinking about Washington in particular and the North Sound, one of the challenges is definitely going to be getting race ethnicity data and thinking about kind of what the disparities look like. As we were going over the data coming out of the state so far, there is race and ethnicity data, but it is incomplete to the point that it's hard to make conclusions based off of that. So both from a mortality perspective, but also from a hospitalization and infection perspective, we know nationally, because the sample size is a lot larger, what this looks like, but within the Northwest and within Washington, this is a big challenge right now and sort of a big unknown. Taking a step back, I mean, one of the things that we're seeing a lot of, and in particular within the North Sound, the immediate impacts that people are feeling are largely on the economic side. Certainly there are health impacts, and folks are dealing with infections and the side effects of that. But the North Sound has largely been successful, and I think Washington State has done a good job in the last 60 days of really managing the infection after the initial peak in March and April. So the upside is certainly less of a story around the COVID impacts, but the downside is the the economic impacts have been really severe. So just within the North Sound, 5 counties, as in the last 90 days, almost 70,000 people are newly unemployed. And this is continuing unemployment. So some number of them have, the number that has been unemployed at some point is probably about double this. And this translates into about a 16% unemployment rate, which is hard to emphasize. I mean, I know everybody's been seeing the numbers, but this is really unprecedented. So for this number of people to lose income this quickly, we really are struggling to both understand the scope of that and what the implications are. But there's a moving chain of potential sort of windows where this can get worse as income support and the additional UI money expires in July. If that's not renewed, there is a big opportunity for these folks to slip into long-term poverty. So from an equity perspective or disparity perspective, the industries that have been hardest hit, so retail, restaurants, hospitality, healthcare, also tend to be the ones with the highest employment of women and minorities. And so the unemployment number is actually, when you dig into some of the stratification, is pretty different depending on which community you come from. And women in a minority community are about 6 times more likely to be unemployed than white men. And the sort of flip side of that is those same industries are also the ones where we're seeing the least amount of recovery. So restaurants, hospitality, et cetera, are probably looking at long-term employment levels that are 50% below what they've been. And so this has dramatic implications for long-term poverty within most of the communities in the North Sound and across the country. So thinking about social impacts, again, the ripples continue to extend out. So there's a number of social impacts and challenges that are associated with this. For example, about 2/3 of licensed childcare centers have closed for 30 days or more. Obviously, many of them are beginning to reopen, but this has exposed one of those structural inequalities, especially for single mothers who are trying to work. This has been a really difficult period. Thinking about mental health, there has been some good modeling and research work done about the potential for both the COVID impacts as well as the economic impacts to increase substance abuse, depression, anxiety, and other mental health disorders. So if you look at, in particular, suicide and substance misuse, the latest models that we've seen show about 3,000 additional deaths over the next 12 months within the North Sound counties. This number gets close to 100,000 nationwide. So there's a really large potential for these sort of longer term mental health impacts. And then housing and food are obviously also impacted. Some of the numbers we've seen are about doubling the increase. I think it's probably close to tripling now, actually. Mortgages, which are in forbearance, 30 days overdue. And about 1/3 or more of renters are behind each month. And some of the numbers showing that this would probably be close to half or more of renters if it weren't for the $1,200 recovery checks, which were sent in early April. So again, there's a large potential that this is going to get dramatically worse over the summer. And then 22% of all households are food insecure, and nationwide seeing food bank demand up by about 600%. And then almost 50% of mothers with children aged 12 and under are reporting food insecurity. So big picture, the social challenges, of which these are just a few of the statistics, obviously have pretty significant long-term, or the potential for significant long-term impacts within communities, and dramatically changing the needs for social services. So as we were looking through the data, a couple of things popped out we wanted to highlight for North Sound in particular. One of them, or sort of these first two points are related. Understanding the breakdown around equity is really important, and one of the key aspects of that is obviously generally what's happening, but also what's happening in tribal communities. And there are these dual challenges that tribal communities are facing around data sovereignty. Data collection looks really good, but there's this separation between reporting at the state level and what the tribes are capturing. And this means that we don't really have a good, comprehensive, cohesive picture that's inclusive of the tribal communities. And combined with a delay in federal dollars to support engagement and reporting, this poses a pretty big barrier to really understanding the equality and disparity impacts. So as we, the sort of other angle or other item is overall, Washington State and the North Sound doesn't see the same level of population, race, and ethnic breakouts that some of the other parts of the country do. And about 70% of the population is white. So one of the challenges there is that there's this big population where poverty is probably a good indicator of potential outcomes, but we don't have really good data about how the economic or COVID impacts have separated out by income level or by poverty level. And so this is going to present a continuing challenge in thinking about where these impacts are distributed and how race and ethnicity fits within that context. One of the things we've talked a lot with Nicole about too is in thinking about COVID and infections, this idea that the North Sound has been largely really successful, as has Washington State, in managing the outbreak after the initial surge. Ongoing infection rates have been really low. That does increase the risk going forward for the community because community level immunity is so low. The risk for widespread community spread is really high. And so managing both these economic impacts and social impacts while at the same time continuing to aggressively manage the potential for outbreaks and health impacts is going to be a real policy challenge for the region. And last thought is unlike King County, which or Seattle, which is largely urban, there's the North Sound has a mix of sort of semi-urban, rural, small communities and tribal communities, which are all going to have differing characteristics of impacts. So what it looks like in Bellingham versus Island County is going to be particularly different, and coming up with a coordinated region-wide response is going to have a deeper understanding of the differences, the risks, and the support that exists in each of those different regions. And so getting the data and the analysis and the understanding around that is going to be a challenge going forward. So let's pause there. I know there's been a number of different questions, and then we're going to go through a couple of quick recommendations and turn it over to Gwen. Okay, so question around additional deaths for mental health. So that's based off of some of the modeling done by Wellbeing Trust. So we can share some of the research we used for that. And we'll put, as we send out the slides, we'll include sources for all of the numbers that we included as well. So yes, let's see here. Okay, looking through chat. All right, yeah, so some good discussion around the mental health pieces as well. So Dennis, that's really helpful. Take a look at that. All right, any other questions about impacts broadly? Oh, sorry, Gwen, lost you there.
There's a question, the questions about the calculation for the estimate of the additional 3,000 deaths. So I wanted to make sure you saw that one.
Yeah, that was that number came from some work that the Wellbeing Trust has done around mental health modeling. So we'll send out some of the research in the slides afterwards. All right, and thanks, Dennis, for chiming in. I know you guys have done much more local work, so that's really helpful. All right. So in thinking about how we can improve our response, again, I think the key point, specifically around equity, that has come out again and again, is this is a real time and an opportunity to make progress on these structural barriers around equity that we all see. There, again, I'm struck continuously at how big a change this has been for most folks and continues to be, and the opportunity for impacts going forward. And in some ways, that level of unprecedented change gives us an opportunity to bring resources to bear in a way that would have been impossible 3 or 4 months ago. And so the opportunity for communities is to think much more expansively about not just the immediate impacts and how do we address them through programs and interventions, but also at the same time, how do we begin to address these larger barriers that we've known about for a long time. So as we think about that and how do we begin to do that, we've got some sort of broad level takeaways, and then Gwen will walk through a specific sort of roadmap and framework that we found helpful to think about these. So talk about the data side first. So the key thing around data, especially with equity issues, is these are really complex, and I think that chat discussion about mental health is a great example where there's a lot of different sources, there's a lot of different modeling from a data perspective. You know, the upside of the last 3 months has been everybody is now familiar with models and with data visualization in a way that they weren't before. And so from a decision-making standpoint, that presents a real opportunity, but also identifies this need that, you know, data is everything. Having data-driven decision-making means that you need to have both the right data, it needs to be correct, it needs to be accurate, but you also need broad literacy around data and how to interpret it. What assumptions are going into the information that's captured. And this idea of being able to segment, to drill down into the data, to disaggregate it in a way that you can really identify you know, meaningful insights about populations, about challenges, about risks, is incredibly important, and is probably also the biggest gap right now. The second thing is that visibility needs to be what we call hyperlocal. Across the board, we've seen with COVID impact forecasts, as well as with some of the economic forecasts, a lot of the data is coming out nationally or at the state level. And I'm sure, as you all have seen, what is reported at the state level oftentimes misses some of the key things that are showing up at a local level. So the state averages can hide some of the effects that are incredibly important to focus on. So we really encourage and both identifying the need and the gaps around local data, and then working as a community to begin thinking about how you're able to fill those gaps without necessarily being able to rely on state or national sources. And then the last kind of takeaway is, the data can be really helpful, but it isn't a replacement for recognizing and learning about individual experience. And so these aggregates always are going to hide that it's real people underneath, and the numbers represent, those individual experiences. So sometimes taking a step back and combining the quantitative with the qualitative, with case studies, with narratives about how individuals are actually feeling the impacts, can be an incredibly powerful way to motivate a community and motivate a discussion around what needs to be done. All right, well, I'm gonna pause there and hand it off to Gwen, who's gonna take us through the last half here.
Great, Mike, thanks. I think the second principle, after sort of trying to understand the complexity, which is really sort of data focused and the intersection between health, economics, and social impacts, is the coordination and collaboration. And that's sort of across government or across sort of agencies, right? And I see a variety of people on this call, but being able to look at not just sort of economic health and economic recovery, but human and social recovery, and be able to communicate that sort of within a government, but also across sectors. So across public sector and across private sector. Coordination, collaboration also requires some scenario planning, right? So really being able to look sort of short, medium, and long term and iterate from the scenarios, because as we're collecting data, as we're realizing sort of the twin challenges of sort of the public health crisis with the economic crisis, we're going to have to be able to plan for scenarios, iterate, and so forth. The last thing is to remember that sort of the basic needs come first. And this sort of a little bit ties in with the individual experience that Mike was talking about. But one area that I work in is gender equity. And it's like, okay, well, we get women back to work. Well, you can't just say, okay, go back to work. There's childcare, there's, income support, there is food insecurity. And so what does that look like together? And, somebody's got to have like food and, housing in order to be able to sort of go back to work. So how do you look at sort of what are the immediate needs and what are the long-term needs? And then, we keep saying this over and over, and this is, we're talking to you all who are locally faced, but community-based solutions, are the key. And the ones that can address sort of the immediate needs of the community, but also look at sort of how do we render and how do we solve some of these systemic inequities around the wealth gap, if you will, or around, communities of color, vulnerable communities. And we really got to sort of start local and learn local. And that's where both the services will come from, the solutions and the best practices. And so that's kind of a really interesting place to start. Next slide, Mike. And then sort of the third kind of, if you will, best practice or thing to remember is that, in order to have action and impact, you've got to communicate, iterate, and scale, right? So you've got to share information. So one of the principles is understand the complexity of the problem and getting this data as is going on in the chat is being able to share this broadly, being able to be transparent, but also being able to share what services are being offered, what things you're learning about. Being able to evaluate, iterate. We have to change. We're going to learn some things. The situation is going to change in ways that we may or may not have foreseen, and being able to pivot. And you pivot by sharing information, by learning, by accepting and discussing failures just as much as successes, and then sort of expanding the coalition, right? So how many more people and partners can we bring in? And I worked and lived in various conflict zones across the globe, recovering from war or recovering from Ebola or recovering from other types of pandemics. And the key to success is kind of the everybody working together, right? And it's the whole community coming together to say, we're all in this together and we're all going to develop those solutions together. So as you coordinate, there's also, you collaborate and you really actually take actions and do actions together. Next slide. So one of the things that we thought would be helpful to do is kind of lay out some suggestions about kind of a roadmap. And I'll start by kind of looking a little bit at the kind of bringing women back into the workforce example, and then talk about sort of short, medium, and long-term actions and outcomes. And then I'll turn it over to Nicole to talk about kind of what it looks like from the North Sound perspective, but in an attempt to say, okay, concretely, what does this look like? So the first thing, as we've talked about, is the strategy has to be comprehensive. So if we're looking at, for example, bringing people back to work, right? There's the immediate need of earning an income and then systemic barriers. We know that women, people of color, and minorities, they don't get paid the same, they don't rise the same, they don't have the same employment opportunities. So as you're looking at sort of response and recovery to COVID and the economic impacts, you've got to look at bailout packages that deal not just with sort of formal work, but informal and temporary, right? And then you have to look at what kinds of jobs. The workforce is arguably changing. There's more remote work, people are probably traveling less. What are the school skills and tools that people are needing to sort of navigate this new environment, right? Entrepreneurship. And so really looking at entrepreneurship. And what is really interesting sort of in the broader gender space is that women-owned businesses generally get less than 1% of any sort of venture capital and support. Child care centers across the United States received very little, if nothing, of sort of PPP support. So really looking at like where does that money go, and starting this sort of entrepreneurship model and making sure that you get financial support for that. And really looking at, as we've said, we've brought in, if a woman is to go back to the work, and it can be very similar to sort of a man going back to work, right? But you have to look at childcare, what's going to happen to the children. You have to look at access to finance for the business owners, for salon owners, for childcare center owners, for hotels, and what kind of support. And then you have to look at your access to finance and credit. And that often means that banks or institutions that are providing finance or credit or capital have to know their client, have to know the products that their client need, and have to really understand how to get that money in the most helpful way. One of the lessons we learned in 2007-8, for example, is you can't just load up a bunch of businesses, restaurants, I'll use an example, with a whole bunch of loans because you saddled them with a bunch of debt, right? So what are the incentives? What's sort of a more holistic ecosystem of economic recovery that can drive people to rebuild, potentially in the construction industry? How do you provide money and incentives so that you're not saddling everybody with debt? Next slide, Mike. So for example, in the, this is the kind of comprehensive approach, or what are the policies that need to be into place to put women or people of color and minorities kind of back to work, if you will. And there's a timing, right? You can't do everything in the first month, the first 2 months, or the first 3 months. Right. So part of it is what we talked about. What are the immediate things you need to do? And there's things like the PPP support and the stimulus checks, and there's the getting to know the data and understanding what's going on in your community, and in a region, what's going on in different parts of that community. There's collaboration. And then there's, let's look at the education and training. Let's start revamping our funding vehicles. You'll see the word coalition, collaboration, incredibly important, because you're bringing things like housing, health, hunger, food security all together under policies, and hopefully policy processes that allow people in the transportation sector to be having conversations with people in the housing sector to understand how these all fit together, because the average person deals with all of these services in a much more holistic way than is often spoken about. Next slide. So in terms of kind of like what's the short term, here's some short term actions and outcomes. And this is not meant to be, what do you call that? Final or discrete, right? But short term actions are really mapping capacities and skills. So there is a national disaster recovery framework. Certain communities are adding in COVID, but there's something from which to start. And in a local area, what are the gaps in both federal and state services? What are the gaps in skills and capacities? And that goes to the understanding the complexity of the problem. The second is starting to build these coalitions. So starting to build, there's 36 people on this call, but these coalitions across sectors of government, across the public and private, but also from state, local, and national. And then the third piece that's really important, which is kind of, a lot of the driving purpose and discussion today, is to improve the data gaps. What data do you need? How do you collect it? how often are you updating, but also how often are you communicating? And that goes to transparency. You know, data for data's sake is not very useful. How are you using it? How are you making it understandable who you're sharing with? And if it's not transparent, if it's not shared, if it's not accessed frequently, it doesn't become helpful in providing evidence-based policy solutions. What are the outcomes in the short term? Well, hopefully a comprehensive data strategy, which we'll talk about later. And embedded in that is a bit of a data dashboard, right? So you don't want to just have Excel spreadsheets of a bunch of data, but how are you understanding it? How can you access it? And how can you use that to inform your policy, both processes and outcomes? Starting to put in place collaborative processes systems. It's hard to talk across silos of government. In the women's leadership space, you know, I can't get the data, just you guys probably all know this, but you can't get data for the number of women judges in the United States, simply because it's often not disaggregated by sex. Everyone has a different data system. Even within a state, it depends on where that's stored, who collects it, and how to get it. So you really have to start building these collaborative processes and systems. And you have to start thinking about it, communications and advocacy. When you look globally of the countries or the leaders that have responded the best to COVID or get praised to COVID and economic recession, it's people that practice that really good crisis communications, clarity of scenarios, clarity about what's happening, communicating with empathy, and communicating with the populations.
One thing, Gwen, I would add in here too, just kind of the nuance on data availability. The sources that we typically rely on for insight into these communities, you know, the Census American Community Survey or the Burfus data out of CDC. The challenge is those are collected so infrequently and released so infrequently once a year that the data, the next time we'll get data that gives us insight on what's happening today is going to be 2021. And obviously that's not tenable. So I think there is a bigger conversation in the short term that I think Nicole will segue into around where do we start to get some of this data more quickly, and how do we do that in a way that can inform decisions over the next month or number of months, because that is, I think, from everybody that we talk to across the country, one of the biggest challenges is like, how are we going to get this information that we've previously relied on, where right now it doesn't exist, and we know the data that does exist is so beyond, so irrelevant 4 months later or 6 months later, that we're sort of flying blind. So a big topic, and I think big opportunity for these types of collaborative engagements and for you all on the phone is to be thinking about, and we've got a real life example here with Dennis of, okay, so, an agency or an organization has some projections or some modeling. How can that be disseminated and how can that be made available in a way that's more strategic?
Great point, Mike. So this is, some of the data questions that sort of Mike and I, Nicole and others have been talking about, of kind of the missing data, and this goes to the impacts, right? How do the impacts correlate with poverty, which we talked about earlier? What are the new vulnerabilities in the last 90 days? What are the acute, what are the big trends? And part of the trends is you sort of realize over time, but part of that is being able to kind of identify and collect it and being able to kind of understand it, so you can, hopefully pick up on the trends or forecast the trends or see them. And, that the minority populations and the vulnerabilities coming out, 6-8 weeks after sort of the pandemic hits is sort of an example of that. The next slide, we'll talk about sort of medium-term actions and outputs, excuse me. And this is really where, the scenario planning, has to be happening. And there's some great tools out there. And I know a lot of mayors, for example, have been having conversations about scenario planning tools to do that. What does that look like? Again, really starting to get the collaborative process, not just the coordinated, but the collaboration kind of really moving, so that you're sharing information, you're working together, you've got sort of a timeline in action, and you're really looking to how are we going to move this together and avoid the silos. Often what will happen is, there'll be sort of this one czar of decision making and everything will be made, but if you're not seeking the other voices or the other realities of what is going on in the community or another agency, it's hard to tie that all together, either operationally from a budget standpoint, or definitely from an outcome standpoint. Many communities are putting sort of an equity focal point person in place. Even places like Dallas, which are having both sort of an economic recovery and a health and social recovery group, have an equity focal point, which can sort of help those communicate to think about vulnerabilities, to think about the equity impacts. What are the skills and capacity and tools for forecasting, and really starting to iterate, because the recovery of this, and in some ways, some of these impacts are going to be felt, beyond, August and definitely well into 2021. So being able to iterate as this unfolds and respond as a community in a coordinated mechanism. So when you go over to kind of the output side of what does the medium term look like, it's, regular coordination, daily, weekly, that's even data sharing, regular communication, sort of the forecasting, and really starting to kind of link those policy or sort of sectors of government solutions together. So how does this all sort of hang together? How does this all work together? I live in Arlington, Virginia, and there's been a big push for example, to get sort of the food and the food banks to communicate with the public school system in terms of, the educational school year and the students that are at risk. And it's working well, but it didn't necessarily start off that way. Next slide. And then long term is really being able to, when I do the work that I do overseas, we talk about, as you can imagine, sort of the Haiti earthquake is the response or the immediate recovery, but then there's really long-term recovery and building up resilience. So, how are we understanding our response? Because that does set the stage for 12, 18, 24, 36 months. And then the systemic synergies is really aligned to the systemic inequalities. How are we breaking down the silos, both in terms of vulnerable communities, but also in terms of policy processes and policies, so that we can coordinate the response, so we can provide a holistic response. And that starts with understanding what the need is. So the outcomes we want are sort of public and private sector investments aligning, right? Not independent of each other, but aligning. It's not the food bank that gets, 1,000, pounds of frozen pancakes, or, mangoes on top of mangoes on top of mangoes. They can't actually deliver. And sort of the situation in the Bahamas of what is actually the need versus what does everybody want to give. The second thing is the sustainable processes. So hopefully we're shifting a little bit of the systems, the data, the way we work together to really meet the vulnerabilities for the longer term and continue to do that. And then, I can't sort of emphasize enough the communication, because part of what is successful at a community level and what's very successful at a national level too is this sort of trust. And part of building the trust between the communities and the agencies providing services is understanding and communicating what is happening, where the services are, what's the forecasts are looking like. And so really communicating not only internally, but externally about what is happening. So I think the key recommendations for the North Sound, we'll set this up for Nicole right after this. So, part of it is, so we've said sort of three things: understanding the complexity, collaborate, and action. So understanding the complexity is really the data piece. So improve understanding of local data collection, sharing that, data transparency and frequency, daily, weekly, harmonizing, right? So bringing everything together, and understand the impacts and access to service for the distinct populations, being able to map that out and what does that look like? Because not everybody is going to recover the same. Not everyone needs the same response services, but the community as a whole needs to have services and policies and processes that respond to the needs. Again, collaboration, I feel like, and collaboration is different than coordination. Coordination is good, but really being collaborative, moving that next step where you're really working together to design solutions or to tailor, to drive budgets, or to drive policy processes, solutions, hear all of the voices. Start really looking at the systemic barriers. From the beginning, what Mike said is something I fully believe. It's a world now where the landscape is shifting, and hopefully in that shift, due to COVID, the economic recession, and the rise of, criminal and racial justice reform or aspirations, is we have the chance to address inequities right now in a longer term way beyond an advocacy angle. So let's look at how we do that and how we can move that starting locally, and then really need the community behind that. So local banking, funding institutions from the beginning, public, private sector collaboration, that aligning of the investments, people understanding the community understanding the services offered, and being able to kind of move forward in a way that's responsive to everyone's needs. Next slide. So I'm going to hand it over now. And I just think those, are some of our kind of bigger sort of, business school PowerPoint sort of case study pieces of how to do this. I'm going to hand it over to Nicole to talk about what's going on in the North Sound and sort of what are some of the really concrete things that are happening in light of these recommendations.
Great, thanks, Gwen. There are a couple questions kind of specific, Gwen, to your presentation. Do you want to address those now, or do you want me to go through my 2 slides?
I can address them now. So one of them is actually, does ACH have tools resources? So that, how to get in the door of the, so I can't answer so do you want to answer the ones that you can, Nicole, and I can answer the next?
Sure, that sounds good.
Okay.
So Liz, Elizabeth Jennings, I see your question, says, in addition to understanding needs via data, we need people with lived experience to be leading from designing the questions, analyzing the data, and proposing solutions. Does ACH have tools and resources for centering people as leaders in needs assessments? I would just say not yet. We do have access to experts who can kind of point us in the right direction. And truly, this is the hope of pieces of this data initiative planning. So I would say stay tuned, and this is the direction we're hoping to be moving in.
Mike, I want to let you talk about the data privacy and sort of going beyond the zip code, and then I'll finish with the sort of getting in the door.
Yeah, so 2 questions about data. So do you suggest going beyond zip code with hyperlocal? That's a great question. I think one of the things that we find, and there's sort of a new capability around data estimation that didn't exist even 5 years ago. So what we recommend is folks think about hyperlocal as not necessarily aligning with sort of how the data is reported, but rather how do you need to, what area do you need to look at for people to sort of see themselves and their definition of place? So, one example is, rather than thinking of it in zip code, think of it as neighborhoods. And the requirement there is some capability to do some small area estimations or aggregation beyond just the reported zip code level. That will turn it into something that's more relevant. Sometimes that neighborhood can be below a zip code, especially in rural communities. Zip codes sometimes are really not much better than county level statistics because the population is so spread out. So I think the answer can depend kind of on where you are, but certainly having a more flexible thinking around or below zip codes is I think a really important opportunity. And then other question from Abby, any tips using and publishing data while maintaining individual privacy? Yeah, that's a great one. And I think the answers sometimes depend on specifics. So obviously, do you have issues around HIPAA, or what is the relevant sort of regulatory or legal requirement look like? One interesting trend is, given the exceptional sort of situation we're in, I have noticed a lot of states making judgment calls about data they may not have released previously, but sort of in the public health interest are more comfortable releasing. Obviously, you don't want to release names, but people are relaxing suppression rules in ways that are I think good, but also surprising, given most jurisdictions have been really risk averse to doing that. So so generally, I think aggregation and thinking really pretty critically about what kind of information would be sort of ascertainable is an important thing to be thinking about right now, because most, or I won't say most, but I think many decisions around data suppression are made mostly just as sort of a blanket, policy, rather than really understanding kind of what's the risk. So happy to, there's a whole probably big hour-long conversation around that particular topic. And Nicole, I'm sure it's one that will come up as well.
So a last one before I turn it over to Nicole, which was sort of from Mike, which is, do you have suggestions on how to get in the door of the unified command structures and communities? So I think, a couple of things is, one is, approaching city council members and so forth. And that means partly is reaching out, what your organization is doing, or advocacy pieces in a very direct, way. There's town halls. And one of the ways that, works in the past too, is to invite council members or those unified command structures to events that your entities could hold. I mean, it's interesting with everything virtual now, right? But part of it is just how, short bits of how you get your messages and policies and desires heard. That's sort of the advocacy piece of it. The second is sort of, asking for their time on a call or normally I'd say a meeting or something. And the third is organizing situations where you can interact, and, in different ways, kind of surveys and town halls and different ways to get into it. So it's kind of the be big and be bold. Often now, what I remind people, which I think we're all hyper aware of, is there's a lot that we don't know that's going on, right? Or that people are thinking about. And often when I interact, I'm in the DC area with people in the mayor's office or even in Arlington County, is they didn't realize that entity was out there, that somebody was doing that particular policy issue. And the trick is, how do you get in a short, digestible way that they can get to know you, get to know the entity, and understand what's happening? And there's a couple different ways to do that, from advocacy of social media to organizing events, to kind of publishing the what needs to be done, and directly reaching out and saying, how to get involved and what town halls are going on or what meetings. Because often people will say, in the mayor of DC's office, they'll say, well, I didn't really know what was going on. And UPS is saying, well, we're having these transportation issues in the city. And part of that is just them figuring out ways to communicate with each other. I don't mean to brush that over. I'm just very cognizant of the sort of 4 minutes that's left, and want to give Nicole the time to kind of close out with the North Sound ACH work.
Great, thanks, Gwen. And Mike, I would also add just one thing with, if you're specifically talking about the Whatcom Unified Command or another county, that's a role the ACH can help connect. We have strong connections with public health, and there's often a liaison officer that's their job, to connect to the community. That's their kind of assignment. So I'd be happy to follow up with you if you have some specifics. And in Whatcom County, there's a group that is working outside of Unified Command for recovery. So happy to provide that if that would be helpful. So I'm just going to spend, I'll do this pretty quickly. We have launched, this is kind of our launching date, the Data Initiative, North Sound Data Community for Good initiative. And I really see this as kind of four key areas. And I really want to thank Mike and Gwen for how thoughtfully you've provided those of us on the call today with, situation awareness, case studies, and recommendations for next steps. We are going to definitely be using what you've presented as kind of our framework moving forward. So recruitment, that's what we're really working on right now. I'm going to put in the chat box where you can send an email to, along with some links that I'm going to mention in the next slide. So we really are looking novice to expert data mines, and we'd like to plan this kind of a co-design, collaborative, as Gwen's mentioned and Mike has mentioned. That's kind of the key to this. We really want to provide a space to learn from one another, look to experts, pull in. As Mike said, we'll be talking to them again. And to really inform better practices, we also want to talk about data silos. COVID has brought to light how certain agencies have access to really critical, useful, helpful data, but not everybody can see it. So we'd really like to dig into that a bit more. We'd like to improve and talk about how we can pull in, there's some really great experts in Washington that can help organizations improve ability to collect race and ethnicity data in a respectful way. And then also this kind of using data findings to inform decision-making and increase in awareness, including COVID recovery. I'll admit that this to me is kind of the last mile of like a data analytic marathon. It's one that the data community, I think, could use some extra help from experts like Mike and Gwen, who take real complex data and forecasting and have the ability to translate it into very specific community and policy actions. So this is, I'm pretty excited about this last one. And I can't wait to kind of work collaboratively, regionally and locally with folks on this one. Could go to the next slide, Mike. So for some real specific next steps, I've put in the chat box just some resources. And I mentioned in the beginning, you know, we as North Sound ECH will continue to be hosting opportunities for calling us to action for racial and social justice. We have COVID-19 resource webpage that I put in there. We have a vulnerable population dashboard, COVID impact modeling. We will most likely in the next couple of weeks have a COVID community impact modeling, and that's just looking at more social determinants of health data that Mike mentioned today. And July, we are planning to do this data initiative planning for those who are interested, and we're going to get to work right away on this. It aligns with efforts we've been planning to do, and now seems like the right moment to just launch into this. So again, if you're interested in joining the initiative, you're going to have to be taking a leap of faith with us where we're going to design this with you. So we don't have the specifics on what it looks like because it's really going to depend on who is participating. So please email us at team@northsoundach.org. And if you have any other general questions like about unified commands or things like that, you can also email us at team@northsoundach. And that's all for me.
All right. Well, thanks, Nicole. So happy, I know we're a little bit over the hour here. Certainly can continue to answer any questions offline. Again, sort of wrapping up, we will follow up with a recording as well as the slides and sources and any other information. So just wanted to thank you all for taking the time, and a big thank you to Gwen as well and Nicole. And look forward to speaking with you all in the future.
Thank you. Have a good day.
Thank you.
All right.